Welcome to our lung masterclass. In this masterclass, we're going to go into a deep dive into what the lung meridian is all about. So the intention is to talk about the theoretical, philosophical components of what the lung meridian is in traditional Chinese medicine. We'll talk about its actions and indications. So, broadly speaking, what is the lung meridian and the lung organ supposed to do in Chinese medicine? And then we're going to kind of drill down at the specific. We're going to look at the individual acupuncture points as well, so how we locate all of those points. And we're going to talk through about what each acupuncture point does individually, because they've all got their own superpower, if you like. They all do their own little thing. So we're going to do that. We're going to take a deep dive into the lung meridian. So strap on in there. Let's get started. So the lung meridian is always the first meridian in any textbook you pick up, right? So this is the master textbook, right? Deadman's, the Manual of Acupuncture, or a Manual of Acupuncture. There is no book like it in terms of its depth, all right? So there's some fantastic textbooks out there that kind of talk you through how to find each acupuncture point and give you an understanding of what the meridians do and what the acupuncture points do. But if you want the be-all and end-all, it's Deadman's Atlas. And so I'm going to be talking through and using this as my reference as I chat today. It's always the first meridian in any manual or any textbook you pick up. And that is because how the meridians are kind of mapped out are in order of the Chinese clock. And the Chinese clock is split up into 12. So that's 2 hours to each meridian or each organ. And it's thought that the qi begins its journey within the lung meridian, and therefore the lung meridian is the first thing that you find in any of the textbooks. The Chinese clock begins at the lung meridian at 3 o'clock in the morning, and the qi is supposed to reside in and be at its strongest point between 3 and 5 o'clock in the morning. So you'll find this as we go along. You probably already know this, but in any textbook that you get, the reason why it's ordered as it is, it's not alphabetical, it's because it's about the order of the qi. So it's the lung, then it goes into the large intestine, then it goes into the stomach, and then it goes into the spleen, etc., etc., etc. So first point to make note of about the lung meridian is that it's the first point in any of the textbooks. The second thing is looking at where it goes. Like, I've got my little dude here to show it out. But effectively, this is the lung meridian here. All right, so we start off at the anterior chest wall and we go down the anterior lateral aspect of the upper arm, the forearm, and terminating into the thumb. It's got 11 acupuncture points on it. I wouldn't say that we needle the lung extensively, particularly in Western medicine. We don't find that the lung meridian acupuncture points are used a lot. It's certainly not all 11 points. There are some points that I very rarely use, if ever, and there were a couple that I would use fairly frequently. So let's have a look and see what the lung meridian is supposed to do. So the lung originates in the middle jiao. Right now, the jiaos, which is spelled J-I-A-O, the jiaos are how Chinese medicine splits up the body. All right, so it splits up the trunk into 3 sections. The upper jiao, all right, is up here. So this is kind of around about like the heart and pericardium, and the middle jiao, which is where the lung resides, is where the lung resides in the middle jiao. It descends to connect with the large intestine, so that's not too big a stretch of the imagination. We know that the lung and the large intestine are connected. And the lung meridian is a yin meridian. So if we kind of think about yin properties in Chinese medicine, yin properties are all about psychosocial, probably more your systemic health, so your organs health problems, rather than like kind of the pain and the more musculoskeletal type problems. Yin organs like the lung are more deeper and with problems with the organ. Yeah, right. So that's where it's located, in the middle jiao. It also has a few interesting points. So lung 7, which is called Li Q. Li Q lung 7 is what we call the luo connecting point. Now, the luo connecting points, you can find these on all yin channels, and it is effectively the gateway to connect to its yang counterpart. So lung 7 it's a yin meridian, the lung, connects to its yang partner, the large intestine, through lung 7. So lung 7 is referred to as the luo connecting point. And the luo connecting points are a way of kind of like accessing the energy and the chi from its yang counter. All right. So if you were wanting to kind of give the lung meridian an extra boost, if it was needing a bit of a helpful hand, you'd put in a cheeky little lung 7 in there. Pinches some of the energy from the large intestine. The symptoms or the pathological symptoms of the lung channel. Let's have a look. All right, here we go. So the principal functions. It has 5 principal functions. Number 1, it governs chi that controls respiration. That's probably no surprise, right? In Western medicine and Western physiology, we talk about the lung being the main respiratory organ. Chinese medicine, it's no different. It also helps control and suppress or descend chi down to the body. So a well-functioning lung meridian or a lung channel in Chinese medicine helps to allow the chi to descend down the body. And that's really critical. If you think about things like meditation and breath work, which was what we talk about in Western medicine these days, we're thinking about deep breaths, we talk about diaphragm type breathing, we talk about trying to visualize energy or flow down into the bottom part of our body. Chinese medicine was really thinking about this and really trying to conceptualize this idea of chi flowing around the body. And one of the things it's supposed to do is to push it down and descend it. It also helps to regulate the water passages. Now, kidney and bladder are the water meridians, right? So let's not get this confused. It's not saying that the lung replaces the kidney and the bladder. It's not saying that the lung is a water element. It's not. It's a metal element. But it helps to control it, all right? So it helps to kind of give some guidance and some pointers to the water meridians as to what it needs to do. It opens into the nose. Again, no surprise there with respiration. It also helps to control the skin and body hair. So if you think of any skin conditions like eczema are considered to be a lung problem. So the lungs chi is supposed to kind of create this kind of barrier, if you like. So it's called Wei Qi, W-E-I. And Wei Qi is kind of like our armor, right? It's our defensive force field. And so the lung chi creates this. It creates the Wei Qi, which is kind of this barrier that sits on the surface just below our skin or just above our skin. And this is to help try and repel pathogens. And if we remember in Chinese medicine, pathogens are the things that invade our body and can create ill health. So the Wei Qi is something that the lung chi creates, and it creates this force field, right, that sits around the body. And if the lung chi is strong, your Wei Qi is going to be strong. If your Wei Qi is strong, you've got a good, strong defense system. If your Wei Qi is weak, it's the other way around. And sometimes things like eczema, for example, psoriasis, that kind of stuff, that's kind of signs and symptoms that your lung chi is depleted because your Wei Qi is depleted. And the concept is that where the psoriasis or the eczema is, that is where there's like a dent or a hole within the Wei Qi. So I guess some kind of problems, more broadly speaking, with the lung channel. So you can get things like respiratory conditions, so like could be simple as like coughing, a bit of breathlessness, a bit of wheezing, asthma, probably no surprise here, but asthma is a big sign and symptom that there's a lung chi deficiency. It could be things like, what else have we got here? Nosebleeds and nasal obstruction. Those are lung chi dysfunctions. We can also get things like problems of the throat, so dryness, soreness. If we're getting any congestion, that is definitely thought of as a lung chi problem. And now the congestion, we're typically kind of thinking of like a sinus problem, okay? So in and around here, or just under your eyes, or just between your eyebrows and above your eyebrows. Also, So also the lung alongside the spleen are meridians that are thought to help control edema as well. So if you've got edema, so excess swelling in places, that's thought to be because of the lung chi. And also obstructed urination. So that can happen because, remember I was saying the lung itself is not supposed to directly influence water, but it helps to govern, it helps to direct the water meridian. So if the lung meridian is weak, the lung qi is weak, it's then thought to be going, well, do you know what? This is going to maybe have an impact on not allowing us to urinate. Interestingly as well, you'll see some bits there about vomiting. So this is to do with rebellious stomach qi, apparently, and the lung is kind of integral, got another little link in with the stomach meridian as well. And that's where that is as well. So the lung meridian, a lot more than what we would probably think of in Western medicine. Yes, it's got all of the respiratory stuff, so like retained sputum, secretions, breathlessness, asthma. All of these kind of things are what probably we would associate with lung problems. But in Chinese medicine, there's a lot more, particularly around the skin conditions. It can influence things like your urination. And it's around like kind of like your general capacity for defense. So your defense mechanisms through that thing called Wei Qi. Our first point of the lung meridian, Lung 1, known as Zhongfu, or its translation means middle palace. So here's some commentary on Lung 1. Zhongfu is the front mu point, mu is spelt M-U, is the front mu point of the lung. The term mu means to gather or to collect, and the front mu points are where the qi of the Zhangfu gathers and concentrates on the anterior surface of the body. Zhongfu Lung 1, like all the front mu points, therefore acts primarily on the lung zhang rather than the lung channel. According to the Spiritual Pivot, so this is an ancient text, the lung is the canopy of the 5 zhang and the 6 fu. As the uppermost zhang, the lung receives via respiration the clear qi of heaven, or the jing qi, and in the same way that the canopy of a forest receives the light and air for essential life. Through the inhalation, the lung descends the qi to the kidneys, and through exhalation, the lung disseminates qi to the surface of the body, expelling waste qi. The lung is therefore said to dominate respiration and to both descend and disseminate the qi. So a couple of things to pick out here. What is the zhang and what is the fu? The zhang fu are ways of describing the organs. So zhang are the yin organs and the fu are the yin organs. Are the yang organs. So zhang is yin, fu is yang. It would have been much easier, right, if they had zhang and yang, just as because of the rhyme. But that's the way it goes. So really we probably should be talking about it in yin and yang terms, but you will see the phrases zhang, fu used quite a bit. So it's the uppermost of the zhang, the highest one of the yin meridians, and we know our anatomy from that. That's no main surprise. And the idea is that we receive half of our post-heaven qi from the lung because it brings in the qi from the air and the atmosphere, and then it also transmits it, translates it, and then gets rid of all of our waste qi as well. Right, so these functions may be impaired either when the lung qi is deficient or when excess pathogenic factors, whether internally or externally. Remember the difference between internal and external pathogens. Internal are the ones that we kind of generate from our thoughts. External pathogens are kind of things in the air. In Chinese medicine thousands of years ago, that bacterium and stuff didn't really know what it was, but kind of knew that there was stuff out there that we couldn't see that was influencing our body. So the lung is impacted by internal or external generated pathogenic factors, and it can obstruct the lung. Lung 1 is used to clear the excess of all kinds from the lung, whether it's due to an exterior pathogenic factor like cold, heat, or wind, which penetrate to the lung zhang, or to internally generate disharmony. So that's like kind of your phlegm stuff. In all such cases, there will be dyspnea, so that's shortness of breath, coughing or wheezing, and an oppressive full sensation of the chest. The lung stores the qi. When excess, there is dyspnea and fullness of the chest with an upturned face. These symptoms will often be exacerbated on lying down, which places more strain on the lung descending functions, as well as allowing phlegm to accumulate. So what we're seeing here is that if you suspect that there are any pathogenic functions, there are any pathogens involved on the meridian, you could needle Zong Fu. Okay, so you can needle Lung 1. Broadly speaking, what else have we got here? Anything else interesting? Here's a bit more about the water, right? So, according to a saying of Chinese medicine, the lung is the upper source of water. The lung can be compared to a lid. For example, the lid of a teapot. When the lid is too tight, the tea cannot pour. And when the lung in the upper body is in excess, the fluids remain above and are not excreted below. Zong Fu Lung 1 is indicated for acute swelling of the face, which occurs when exterior pathogenic wind obstructs the lung's function of regulating the water passages and descending body fluids. I.e., if you've got swelling of the face, what we're seeing in Chinese medicine is that the lungs it's been too contained, too restrictive, and therefore we kind of need to release that to allow the fluid to drain back down to where it should go. And Lung 1 Zong Fu is the one that we should be needling. So some broad stroke indications of Lung 1 Zong Fu. So cough, coughing, phlegm, blood in the phlegm, pus, dyspnea, wheezing, asthma, fullness of the chest or chest pain. I mean, if somebody's getting chest pain, particularly on the left-hand side, I'd probably call the emergency services maybe, rather than just mucking around needling Lung 1. Just an idea. People who have difficulty in breathing, and certainly when it's all of these kind of symptoms are when they're lying down, because the lung has to work harder when it's lying down. Heat in the chest, aversion to cold, chills and fever, and sweating. If they have a painful throat, if they have nasal congestion or swelling of the face, difficult ingesting, vomiting, and then if they have skin pain as well. So these would all be indications of Lung 1 Zong Fu. All right then, Lung 2 Yunmen, which is known as Cloud Gate. So what does good old Cloud Gate do? Not much, in fact. All right. In fact, if I would give you an idea, it is not even a page worth of description. So Lung 1 Zong Fu has nearly 2 full A4 pages. Lung 2 doesn't even have 1 page. So here what we have from Deadman's Atlas. According to the essential questions, Yunmen Lung 2 is one of the 8 points for draining heat from the extremities. So you would be needling that with something like Bladder 40, Governor 2, and that's about it. That's all it says. Doesn't really go into any kind of deep philosophical chat here. So the kind of symptoms where you might be looking at needling Lung 2 are cough, wheezing, asthma, dyspnea, and an inability to lie down, shortness of breath, oppressive and agitated sensation in the chest, heat in the chest, oppression and pain in the chest, upsurging of chi to the heart, sudden pain of the heart and abdomen. I mean, again, if you're getting these symptoms, I mean, I'm sure that you don't need me to say this, but if you're getting pain in and around the heart region, particularly the left side of the chest, let's not muck around about whacking needles in to this triangle around here. Let's get the emergency services called ASAP. Pain of the lateral costal region and back, pain of the back and shoulders, pain of the shoulder with inability to raise the arm, pain of the suprascapular fossa. So effectively, if you're getting any kind of anterior shoulder pain in and around this area, this could be a point that you could use. And I think that the other little bits it says here is about painful throat. That's about it, all right? A lot of the very, very similar things to Lung 1. Okay. Lung 3, known as Tianfu, or the Palace of Heaven. Now, you have a group of acupuncture points called the Window of Heaven points. There are a group of them. So there's Lung 3, Stomach 9, Large Intestine 18, Tanyu, which is Sanjiao 16, Bladder 10, Ren 22, Small Intestine 16, Small Intestine 17, the Governor 16, and Pericardium 1. What is interesting about all of these points is that they're in and around the neck and the head region. And Window of Heaven points seem to be, when we look at them, do a group of the similar kind of symptoms. So any problems in and around the head and neck, particularly with headaches, these are the kind of the things that they tend to be doing. They tend to be doing things with dyspnea, coughs, wheezing, any sudden onset of problems, and any kind of psycho-emotional disorders as well. So that's and the last one is about the sense organs. So basically anything in and around here, nose, mouth, ears, eyes, all these window of heaven points are supposed to help these. Any psychosomatic problems, which I guess we can kind of get right, because psychosomatic being in the brain. So lung 3, despite it being in a bit of an odd place, right, just up here on the upper part of your arm, seems to be quoted as one of these window of heaven points that in Chinese medicine actually can have a big impact on a lot of stuff. So that in and of itself is an important thing to mention. It's listed as one of the window of 5 heaven points. So lung 3 shares these points in common actions of treating goiter due to stagnation of qi and phlegm in the neck region, descending the qi of the lung, benefiting the sensory orifices, in this case the eyes. It is also interesting to note that its ability to treat goiter as well as eye diseases is shared by 3 points of the upper arm. So lung 3, large intestine 14, and Sanjiao or triple energizer 13. So that's interesting. That's all kind of like upper arm region, right? That's all in and around here. There is no apparent explanation why these points, rather than more distal points, should have such an action, and this is predominantly a reflection of empirical observation. I wonder how that came about, right? Because when we're talking about acupuncture, almost always we're talking about the super strong things in your wrists and your hand and your ankle and foot, right? You've got your ear and all that kind of stuff. But mainly that's where all the super powerful ones, normally in and around like a shoulder or whatever, they're very good for like shoulder pain, full stop. Don't do anything else. But yeah, it's an observation that's been made. Other things that they might do, again, you've got all the stuff that the lung is supposed to be problematic when it gets injured, wheezing, dyspnea, cough, asthma, nosebleeds. Oh, so here's a few interesting ones, right? Insomnia, sadness, weeping, disorientation and forgetfulness, floating corpse ghost talk, and melancholy, crying ghost talk. So yeah, so ghost talk, right, and a quick check on your reference here. Ghost talk is referring to the mental processes and really difficulty in trying to solidify a thought process. Okay, so when we read that second set of points here, right, so things like insomnia, sadness, weeping, disorientation and forgetfulness, the ghost talk scenarios and melancholy, crying, ghost talk, a lot of stuff there, you know, you can kind of think of, maybe in Western medicine we'll be talking about things like depression, maybe even things like menopause, right, and perimenopausal symptoms. Interesting. Okay, so we've got things like goiter, swelling of the throat, pain of the inner aspect of the upper arm, dizziness, swelling and distension of the body, malaria. Go and see a doctor if you've got malaria. Purple-white wind blotches, and visual dizziness, short-sightedness. There we are, Lung 3. Oh, look at this. Right, we've got a few little other bits of nuggets of information here, right? So according to Chinese medicine, the lung stores the corporeal soul, the Po, right, P-O, and one of the 5 aspects of the spirits, which is what the Po is. So the palace of heaven, which is Tanfu or Lung 3, is indicated for a range of psycho-emotional disorders characterized by sadness, weeping, disorientation, forgetfulness, as well as for things like insomnia. It's also indicated for floating corpse ghost talk. This term probably refers to the delirious speech seen in the terminal stages of pulmonary tuberculosis. Oh dear. So in one of the ancient texts, it specifically refers to the melancholy, crying ghost talk in relation to this point. It was this great physician himself who classified pulmonary tuberculosis. Interesting. An alternative explanation is that the term does in fact refer to raving or nonsensical speech attributed to demonic possession. A contemporary book on Chinese folk beliefs explains in cases where the ghost's influence was the result of a gradual process, the victim would initially be sad, sensitive, and withdrawn. As the ghost's powers over the victim's mind became stronger, he would begin to behave as if he were in a dream, talk about ghostly matters, or act as if he were conversing with ghosts. Lung 4. So lung 4 is known as Jai Bai, or clasping the white. Now, this probably kind of gets us back to what we would normally expect. So this is kind of like upper arm here, upper lateral aspect of your arm. Probably not expecting it to do a lot, and it doesn't, not even a page, right? So things that this one does is, I mean, it doesn't even have any kind of lovely description to it, right? It's just like literally straight to the point. What does this point do? So again, the cough, the shortness of breath, all that kind of stuff. We've got a bit of palpitations, heart pain, pain in the medial aspect of the arm, and purple-white wind blotches. So not really a lot. We're probably thinking about this one almost exclusively for pain in and around the lateral aspect of the bicep. Qi Zi, which is lung 5. This one's sometimes referred to, or the translation as cubit marsh. Cubit being the cubital crease, all right, and then the marsh because it's a kind of little delve in the flesh there, all right. Now, this is where we're starting to get a load of stuff it does, right, and then on our initial training courses, on our foundation courses, we do lung 5 as one of the first acupuncture points in needle, and we talk about it very much in the realm of thinking of this as a local elbow point. And it's very good for local elbows problems, but it's got loads more that it does in Chinese medicine. So it's referred to as a He-Si point and a water point, and these things are pretty important. So the He-Si point, so just more broadly speaking, a He-Si point is normally where the qi enters inwards. So that is where the qi goes from the meridian itself, which tends to be more superficial, and then kind of diverts internally. It's known, so all of the 12 meridians have a He-Si point on them. They tend to be at the elbow or the knee. So obviously lung 5 being the medial aspect of the elbow here for the lung. And they're all kind of indicated for similar things. So counterflow qi and diarrhea, diseases of the stomach and disorders resulting from irregular eating and drinking, diseases of the fu, which is the yang meridians, and diseases of the skin, all right, which is probably no surprise given that the lung meridian is to deal with the skin. It is also known as a water point, and I made reference to this earlier in the introduction that the Chinese medicine think that the lung meridian governs the water meridians. But let's have a look and see what else this does. All right, so excess heat in the lung may be due to interior or exterior factors. Interior factors include smoking, overconsumption of rich, greasy, spicy food and alcohol, transformation of long-standing retention of phlegm, damp, blah, 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 blah. And so that lung 5 might be able to help with this. You would combine lung 5 with some other acupuncture points actually in these scenarios. So where we've got like excess or deficient heat, we might combine this with something like stomach 40 and lung 1. Remember this one that we did, Zhong Fu at the top here. You can do lung 9, which we'll talk about in a bit, and bladder 43 and kidney 3. Other bits that are kind of, I guess, notable things to talk about with lung 5 are obviously the elbow pain, and again, the cough, the phlegm, the wheezing, the asthma, which all of the lung points will do, fever, taxation fever, spitting blood, nosebleed, vomiting, diarrhea, abdominal distension, swelling of the forelimbs, frequent urination, heart pain, agitation of the heart, sobbing with grief. Can't have that, right? Acute and chronic childhood fright wind, epilepsy, clonic spasm. Yeah, actually, that's a good point, actually. So you'll find that we use acupuncture fairly often in neurological conditions, and lung 5 is definitely one. Lungs and small intestines, you find that we use quite a bit in upper limb neurological conditions. Coldness of the shoulder. So coldness of the shoulder, frozen shoulder would be a good example. So basically not able to move very well. Pain of the upper arm and shoulder, inability to raise the arm to the head. So I think that's all very much frozen shoulder stuff going on there. Wandering, painful obstruction of the elbow and upper arm, restricted movement of the elbow pain, difficulty in opening, extending the hand, the 5 types of lumbar pain, crane's knee swelling and pain. And this one's always an interesting one, I think, when we talk about the indications of lung 5. And one of the ones that kind of sneaks in there right at the end is, for medial knee swelling. You're like, well, why on earth is there a point on your elbow, that's supposed to be good for medial knee swelling. It's one that you can put in there. I wouldn't replace that with points local to the area, but it might be another additional one you can use to combine it with that. Okay, so lung 6, Kongju, maximum opening. So lung 6, again, about a page worth of stuff here. All the stuff you'd expect, cough, wheezing, asthma, chest, but you get the deal now, right? A bit more coughing blood, spitting blood, vomiting blood, and hiccup as well, as if all of those things are equally as serious. Do I need to say this? Maybe not. Well, I hope not, but let's assume that I do need to kind of give you a little kind nudge. If somebody is coming into your clinic with undiagnosed spitting blood, vomiting blood, or coughing up blood, it's not for you. Maybe go and get them to go and see the GP ASAP. Severe pain of the elbow and upper arm, inability to raise the arm above the head, difficulty in flexing and extending the fingers. So basically, because it's very close to the common extensors, it'll be something in and around your tennis elbow stuff. But also epigastric pain, hemorrhoids, headache, and clonic spasm. And we mentioned this in lung 5, where we look at lung points, or we can look at lung points for any kind of like neurological conditions that affect the upper limb. Now, probably the other thing to bear in mind here is Kongju, lung 6, is a G cleft point. And a G cleft point, and G cleft is spelled XI-CLEFT. So G is XI and then cleft. G cleft points are the points on meridians which treat acute and severe pain of the meridian. So they can be really good. We talk about this in like sport acupuncture courses we do, when we talk about acute injuries and how to deal with them. We'll look to needle the G cleft point. All right. Lung 7 or LUQ, broken sequence. So this one's a big deal, right? This is the big boy, right? One of them anyway. So this one you'll have done on your foundation training for sure, because it's used for all sorts of things. I mean, just from a musculoskeletal perspective, it's a really handy one because it's just proximal to radial styloid. This is an area like things like tendinopathies, like de Quervain's, that kind of stuff. So it's a really helpful one to do there. So it's the luo connecting point of the lung channel. It's the confluent point of the conception vessel, the Gao Wu command point, and the Ma Dan Yang heavenly star point. My Lord, it does lots, right? So let's hear about why we would use it first. So chills and fever, nasal congestion and discharge, nasal pulps, flaring of the nostrils, throat painful obstruction, cough, coughing up phlegm, wheezing, dyspnea, asthma, diminished chi and shortness of breath, heat of the chest and back, shivering and cold of the chest and back, sweating, sudden swelling of the forelimbs. I mean, sudden swelling of the forelimbs. That just doesn't sound good, right? And as much as I'm a big advocate of acupuncture, I'm not sure that needling lung 7 is your priority there. I think you know what to do, all right? Headache. Now, lateral headaches in particular, for sure. Stiffness of the neck and the nape. One-sided headache. Lockjaw, hemiplegia, deviation of the mouth and eye. Toothache, epilepsy. Childhood fright epilepsy. Acute childhood fright wind. Loss of consciousness. Vomiting of foamy, watery saliva. And wind painful obstruction. We can... there's some other stuff here, yeah. Okay, so this kind of refers back into the, the reproductive system here, right? So retention of the dead fetus, postpartum inability to speak, blood in the urine, hot and painful urination, difficult urination, pain of the penis, pain of the genitals. I like how they've separated that out. Pain of the penis, we obviously couldn't encompass into pain of the genitals, but there we are. It's two separate quotes in there. And seminal emissions as well. Poor memory, palpitations, a propensity to laughter, frequent yawning and stretching, tension of the chest and back, fullness of the lateral costal region, and breast abscesses. So this is interesting, right? You can basically, when somebody's yawning in the face and you're like, are they just bored of me? No. It's just because they just need a good old lung 7 to be needled. So don't take a hit to your ego there, right? It's just because of their lung 7 needing to be needled. Also, propensity to laughter is an interesting one, because I think certainly in Western cultures, we think of laughter as like, oh, people are happy and people are good. And we're not trying to say we don't want anybody laughing. That's not what we're saying here. What it's actually getting at is people who laugh too much. Laughing too much suggests that they're contained and they're holding on to maybe some grief. So too much laughing, we'll whack that lung 7 in. We don't want people to be too happy, right? Weakness of or pain of the wrist and hand, as we said before. Pain of the thumb, shoulder pain, heat in the palm, and malaria. Now, I could go on for ages talking about lung 7, about what it's supposed to do. All right, I'm just going to pull out some of the main pointers here. Here we talk about it being a luo connecting point. So luo connecting point lung 7 is similar to something like stomach 40, bladder 58, and kidney 4, because they are all located at sites where the channel takes a sudden diversion, so a sudden change. So the channel's kind of going along lovely, nicely, and then it changes direction very suddenly. And that's what you see happen at the wrist here. So you have lung 7 here, and then it diverts like almost like at a 45-degree angle towards lung 9. So it says that's quite common for a few of the luo connecting points. So the Ma Dan Yang, the great physician of the Jin dynasty, put this as amongst the 11 heavenly star points, which he grouped together as the most vital acupuncture points. We can talk about that on a different masterclass if that was of interest to you. And it was indicated for things like one-sided headache in particular, and numbness or painful obstructing in one side of the body. So again, we're hearing lots of references here to neurological conditions for the lung. So the clear emphasis on the ability of lung 7 to treat the head and neck region in each of these 3 points groupings is surprising, since the lung channel does not ascend higher than the throat. So it doesn't go into the head, but there are a lot of classic texts that talk about things like that do affect the head. So things like congestions, things like headaches, and like I said, the neurological conditions. So it's interesting because the channel doesn't even go into the head. The effect of lung 7 on the head region as a whole can, however, be explained by the following factors. Number 1, the action of lung 7 on expelling and pacifying wind, whose nature is to attack the upper portion of the body. And number 2, the close connection between lung 7, which is the luo connecting point of the lung channel, to its exterior large intestine point. So the luo connecting point allows us to connect to another acupuncture point, another acupuncture meridian. So it which does very much go into the head. So that's the 2 main reasons why Deadman think that there is actually a reason why lung 7 may influence the head. So lung 8, Jinkyu or channel gutter. It is the Jing River point of the lung meridian, and it's also the metal point of the lung channel as well. Other than that, it doesn't really do a lot. Again, you can probably guess, what might a lung acupuncture point do? Yes, cough, wheezing, asthma, dyspnea. Couple of other bits. It's got breathlessness, as you'd probably guess, heart pain with vomiting, wrist pain, malaria, much yawning. Not to do with your horrendously boring company. It's to do with lung 8 not being stimulated. Also pain in the soles of the feet. So a good old plantar fasciopathy, cheeky little lung 8 just opposite, just one sun down from your lung 7 at your wrist. Who would have thought it, eh? Right, lung 9. This is the one source point of the lung meridian. So this does super duper looper stuff. So all of the cough stuff, all of the breathlessness stuff, all of the spitting blood and coughing blood and vomiting blood. What else have we got going on here? Pain of the eyes, toothache, swelling of the face, weakness or pain of the wrist, pain of the shoulder and back, pain on the supraclavicular fossa, which is obviously where lung 2 sits under here, and pain in the inner aspect of the arm and breast pain. So as the one source point, it's thought that it basically treats any disorders of the lung meridian at all. And what else have we got here? Characterized by chronic weak coughing or wheezing. So in the case of lung qi deficiency, there may also be shortness of breath and much yawning, which I mentioned before. And whilst in the case of lung yin deficiency, there may be heat in the palms and spitting of blood. Anything else of interest? Oh, so this is interesting. So the lung channel has its origins in the middle jiao, and in common with many points of the channel of lung 9 is able to harmonize the stomach. So being indicated for rebellion of stomach chi with belching. So rebellion of stomach chi is basically anything that's coming up towards the mouth, so belching, vomiting, all that kind of stuff. Toothache, superficial visual obstructions, and pain of the eyes and breast pain as well. Yeah, and I said about the supraclavicular fossa pain, shoulder and back pain, and the inner aspect of the arm as well. So lots of stuff in there. Lung 10 is the yin, spring, and fire point of the lung channel. Not huge amount of stuff that's going to go on in here, but really the main points is all of the stuff that you normally get with the respiratory stuff or with the lung stuff. So your dyspnea, your breathing issues, your coughing, you got painful throat obstructions, yellow tongue coating, breast abscesses, toothache, lacrimination, visual dizziness, genital damp itching, impotence with abdominal distension, headache, malaria, and tetany. I don't know what tetany is. Abdominal pain with an inability to eat or drink, sudden turmoil disorder, esophageal constriction due to middle jiao deficiency, vomiting, childhood nutritional impairment. So if you see anything that's going to pull out more on this, nothing really more, but there is a phrase here that I like, right? There's a text called "The Warp and Woof of Warm Febrile Diseases." Warp and woof, viewers. The warp and woof. Last but not least, we have lung 11, which is the Xiao Shang. And when you see this, how we needle this, we don't needle it and leave the needle in. We pinprick the area and we encourage it to bleed. This is because it's the Jingwell point. And with many of the Jingwell points, it's a way to revive collapse, so somebody who's fainted. It's also being indicated for any loss of consciousness from things like a stroke or things like extreme heat. The internal pathway of the lung channel ascends at its highest point to the throat. As the terminal point of the lung channel, Xiaoshang, lung 11, has a particularly strong action on the opposite end of the channel and may be needled or pricked to bleed in all acute disorders of the throat and surrounding tissues due to excess heat and fire poison, as well as simple sore throat due to attack of exterior wind heat. Xiaoshang lung 11 is indicated for mumps and childhood throat moth, a traditional disease a traditional category more or less corresponding to tonsillitis. Oh, there we are. To induce bleeding more easily from Xiaoshang lung 7, basically pinprick it and squeeze it. Yeah, so basically what you get with the Jingwell points is that these are for any acute problems that are at the other end of the meridian or where the organ starts. So the lung starts in and around the throat. So we pinprick the area and we'll let it bleed. That's supposed to help pull everything out of it. So there, in conclusion, in this masterclass, we have gone over all of the indications and actions of each one of the 11 lung points. We know that in all acupuncture points that they will always treat points or problems along the meridian. So if we know the pathway of the meridian, we will know that we can use any point along that meridian. And then it's deciding, well, which one of those points do we go for? It's looking at the specific actions of those points and seeing what they do and correlate that with the patient's symptoms who's sat in front of you. Not necessarily just their primary problems, but also all of these secondary issues. We've talked a lot about cough, dyspnea, that kind of stuff. Look, as long as this has got a diagnosis, as long as there's a reason for this from a Western perspective, they're under the guidance of a doctor, okay. But if this is new, if this is something they haven't sought out some diagnosis from, especially some of those things that are more serious, right? The sudden weakness, the chest pain, the coughing or spitting or vomiting of blood, right? You need to go and see a doctor, right? So don't delay them going to see somebody where it's more appropriate treatment, please, okay? I'm sure I don't need to say that. We also covered about what, broadly speaking, the lung meridian's about. So it's time of day, its actions, its channel, a whole raft of just concentrating on one small meridian in the lung would hopefully find this, you found this helpful or at least interesting. Would love to hear from you because we're going to be doing more and more of these masterclasses. So if there's more that you'd like us to delve into, if you want to see more or less of something, let us know. But for now, see you soon.